Hey guys, my name is Tony Maritato. I'm a licensed physical therapist, and today we're taking a look at the Fit King pneumatic compression device for the lower extremity. Now, this could resolve issues associated with lymphedema, post-acute recovery after a heavy workout, or even post-surgical cases. Anytime we're dealing with excessive fluid into the lower extremity, or we just enjoy the sensation of compression from the foot, shin, knee, and hip, this is one of my favorite devices. Now, I purchased this device. This was not given to me. It was not used as a promotional item or anything like that. I purchased it because I want to start experimenting with it in the clinic. I've recorded a couple of videos already, but in today's video, I want to show you how we use a combination of modalities. We're going to use elevation, we're going to use compression, and we're going to use cryotherapy all at the same time. So let me show you how I'm going to set this up. Let's pretend for a minute I've got a patient in the clinic. They've got a right knee injury or some swelling. We want to do a little cryotherapy on the knee. We want to do some compression and some elevation. This might be in a situation where they've had a total knee replacement or an arthroscopic surgery, or they just tweak their knee. Sometimes that happens. So what we do is, inside each of these devices, there's a label. This one says right leg. We're working on the right leg today. I'm going to place the leg into the device. I'm going to slide it up. And I'm going to grab, this is a cervical Chattanooga ice pack. I'm going to go ahead and place this around the knee. If it was my ankle, I would place it around the ankle. If it was a quad or hamstring, I would place the ice pack wherever I feel like the client would benefit the most from the sensation of cold. So the ice pack's in place. I'm going to go ahead and zip up the device. I can apply the other leg unit to the other leg of the client if I want. If we don't want, I can just leave it off. It does have to be attached, but it doesn't have to be used. So in this case, I'm just going to leave it off. Now, we've got the cryotherapy in place. We're going to come into position. If you look at the clinical research, we know that the clinical research suggests the hip has to be flexed at about 30 to 45 degrees or higher in order for you to get any kind of benefit from the effects of gravity pulling the fluid down. What I'm going to do here, should have planned this a little better, is I'm going to go a little higher. Perfect. Now, I'm going to turn on the device. You can see it's powered on. I've got it set to sequence. We've got 50 millimeters of mercury as my level of compression. It can go up to 120, so there's plenty of room to increase the intensity. And basically what's happening is, when we're set on sequence mode, it starts with compression at the foot, then it moves to compression at the shin, then it moves into the third chamber and the fourth. This is a 4-chamber unit. It's really comfortable. It's made from a material that seems to be very high quality. I will do an updated video 6 months, 12 months down the road to let you know how the device is holding up. Today is just the first day we're using it, so I don't want to make big promises, but so far I've been really happy with it. So I'm going to let it do its thing. My client's just going to hang out. Maybe they'll play on their phone, read something, or just stare at the ceiling. But I can feel the second chamber filling pretty quickly. The third and fourth chamber will be filled. Okay, so let's fast forward. Let's say that we've gone through the 20 minutes. All of the chambers are finished, activating and deactivating. What I'm going to do is I'm going to go ahead and power off the device. I will usually disengage the air hose, and I can feel the air coming out of there as it's releasing. I'm going to let that go down. I'm going to come up, set this guy down, get it out of the way. I'll take my ice pack out. I'll slip my space boot off. And that's it. We're done. That was a fantastic session. Reduce swelling. I always believe in measuring girth. You can do a mid-patellar girth measurement. You could do 6 inches below, 6 inches above to get an idea of what the edema and swelling situation is throughout the knee. But whatever you choose to do in your clinic, I would tell you that so far I've been really happy with this device. I'm glad we made the purchase.